The Ontario long-term care crisis is currently dominating news headlines in every major newspaper and mainstream media outlet across Canada. The failing long-term care system in Ontario is finally getting the attention it deserves, but we cannot let this chance slip through our fingers and waste what could be a defining moment in our lifetime. The key to fixing Ontario's long-term care crisis is first identifying the problems that caused it, and then planning a solution that is going to fix it once and for all. And that's exactly what we're going to do in this video today. Hey everyone, welcome back to my channel. For those who do not know me, my name is Cody. I'm a registered physiotherapist and I practice in Ontario, Canada. I want to start our discussion today by talking about what brought this crisis to light and why we're talking about it today. At the end of April, the Canadian Armed Forces were sent into several Ontario long-term care homes to observe as well as to lend a helping hand to frontline workers. This is because more than 80% of deaths due to the current health crisis has occurred in long-term care homes. Over the past several weeks, the armed forces have collected observations and detailed notes on the day-to-day operations in these long-term care homes. And earlier this week, the Canadian Armed Forces published a scathing report outlining their observations and these detailed notes, catching the attention of politicians, family members, and the mainstream media. The detailed report outlines several shocking forms of unhygienic and dangerous behaviors. These include positive patients being allowed to wander around the homes, exposing other residents and staff to the virus. Personal protective equipment, PPE, things such as gowns and gloves, were seen worn by nurses and staff for hours on end, not even changing them between patients. Residents that were positive for the virus were roomed with residents who did not have the virus. The homes are severely understaffed, and of the workers that are there, some were seen being very aggressive and using derogatory comments towards the patients. The last one we're going to mention is probably the most gross, and that's the presence of insects like ants and cockroaches. Ugh. These shocking observations have led to calls from family members, politicians, and several advocacy groups to tearing up and completely overhauling the long-term care system in Ontario. Now, as someone who has had 10 years of both personal and professional experience with Ontario long-term care homes and hospitals, I can honestly say I'm not really surprised with the findings. And really, this should come as no shock to anyone that either has or has had a family member in an Ontario long-term care home. The cries for reform from a few were never going to change anything, especially when you're going up against the government. But now that this long-term care crisis has national attention and basically the entire population is behind reforming it, let's not waste this time and let's identify the problems of the system and the solutions on how to fix it. Let's do it for our seniors today and for our future seniors of tomorrow. So now that we're all on the same page about the long-term care crisis in Ontario, let's discuss the two problems that caused it and the solutions to help fix them. First and main problem that has caused Ontario's long-term care crisis is lack of beds. See, a bed in a nursing home is where our most vulnerable adults can live and receive around-the-clock nursing and personal care. These are individuals whose needs and care cannot be met in the community. Now, there are 626 long-term care homes in Ontario, and there's 77,000 beds. Now, the current wait list to get a bed is 35,000. That means there's 50% more people who want a bed than actual beds available. Now, just let that sink in. There's 35,000 people ahead of you in line for a bed. So the average amount of time you're going to be waiting on this wait list is 5.5 months. That is crazy. Now, I know what you're all thinking. If there's such a demand for nursing home beds, why don't we just not build more nursing homes and make more beds? And the answer to that is, surprise, surprise, money. See, the cost of a long-term care bed is $1,900 a month, and that rent is set by the government. Now, that $1,900 a month can be covered 100% by the government, depending on your level of income. So we can see that the problem is that the government controls every single aspect of the long-term care home. See, it covers the price or rent, it covers the number of beds, and it also covers who pays the rent. See, but the government won't increase the supply or increase the number of beds to meet the demand, and that's the problem. So why doesn't the government just increase supply and give us the additional 35,000 beds and pay for it? Well, the answer is because they would have to raise our taxes significantly, or they would have to make cuts to other services and use those funds for long-term care beds. See, if one bed costs $1,900 a month and they're going to supply 35,000 additional beds, we're looking at $800 million each and every year added to the healthcare budget. And we know the elderly population is going to grow from 3 million in 2016 to over 4.6 million by the year 2041. So the number of beds we're going to need is just going to keep growing. Now I'm going to offer two possible solutions to increase the number of long-term care beds and get rid of the wait list. Solution number one will be complete government control. The government's going to give those 35,000 additional beds. They're going to pay for them completely, but we're going to have to pay some more taxes, or we might have to make some cuts to other services to pay for it. In this first solution, we're keeping universality, meaning each and every person in Ontario has access to a long-term care bed, but what we're not having is affordability. It's going to cost a lot, and we're not having quality because there's no competition between nursing homes. The complete opposite to solution one, complete government overhaul of the long-term care system, would be the government completely getting out of the long-term care business. This would open it up to a free market. We would have affordability and we would have quality. We would have competition in the marketplace. But the thing is we would lose universality. What this would mean is this would mean privatizing our healthcare system. And anytime a politician mentions private healthcare, it's automatically a loss, it's political suicide. But I'm here to tell you that there is an alternative solution we can do that keeps the government involved and it helps us continuing to take care of the most vulnerable people out there. And that would be a two-tiered free market system. Let me explain. You would keep the government-owned and operated long-term care homes we have now, and you would keep the $1,900 a month beds that are fully subsidized by the government. These beds would be for people who can't afford, who do not have any long-term care insurance. But in addition, you would have a lot more private nursing homes. You would make the application and regulatory process much easier, and you would allow these private nursing homes to set their own rents, to decide how many beds they want in their home. And you would also endorse to the public use of long-term care insurance. Now this solution ensures nobody falls through the cracks. Those who cannot afford it can be taken care of in the government-run nursing homes, and their rents are fully subsidized. And on the other hand, for those who have long-term care insurance or money set aside for retirement, can elect to go into a private nursing home. This solution would drastically cut down the wait list. It would give people choice, quality, and make the system affordable. So that covers the first major problem contributing to the Ontario long-term care crisis, a lack of beds, and it offers two different possible solutions. Now the second major problem is a change in societal culture. Let me explain. Now it used to be that we took care of elders ourselves. We invited them into our homes, we nourished and cherished them, and we did whatever we could to ensure that they were healthy and comfortable. They had such an impact on our lives growing up, helping to raise us and shape us into the adults we are now. It was our moral obligation to take care of them now. But for some reason, we've substituted the government and healthcare workers into our role as family members. Now, with my 10 years of both personal and professional experience in the Ontario long-term care and hospital system, I have witnessed firsthand the neglect that people give to their elderly family members. Patients are left lying in hospital beds for months on end, waiting for a long-term care bed to open. Now, this is wrong. They should be waiting at home with their families. They're taking up a bed space in a hospital for someone who really needs it. And while they're in that hospital for months on end, their family members hardly even visit them. They've been abandoned. And the exact same thing is seen in long-term care homes. People are placed in there and they're forgotten about. They have no or infrequent visitors over months and years. See, I think people have this notion where, well, they're in a place with nurses and doctors, I don't have to do anything. My part is over. And that's just simply not the case. Both of my grandparents were in a long-term care home for a small amount of time right near the end of their lives. But before that, me and my family tried to keep them at home for as long as possible, keeping them healthy and supported. And once they finally had to go into a long-term care home, my family and I visited almost daily. See, showing up and being present for your elderly family members in long-term care homes has several benefits. It helps tremendously on their mental and emotional well-being. They know that you're there for them and they know that you still love them. And you are ensuring that they're getting proper care. See, when the nurses and the long-term care staff know that you visit regularly, they'll ensure that they bathe, they change, and they take proper care of your loved one. See, dropping someone off at a nursing home and never bothering to visit because you think since they're with nurses and doctors, they're going to do everything is a mistake. And what it took to realize how big of a mistake this line of thinking was is a pandemic. See, we have this inherent reflex where we flock to someone who's going to die soon. It somehow makes us feel better if we spend a lot of time with them right before they die, regardless if we've even seen them in the past 5 years. And everyone started to do this during the pandemic. They visited their loved ones, they realized how poor the Ontario long-term care system is, and now everyone together is finally trying to fix it. In summary, the Ontario long-term care crisis was caused by two main problems in my mind, and that was the lack of beds and the change in societal culture. This is going to take a lot of political courage, but we need to have a serious debate about what we want in our healthcare system. Are we looking for universality, affordability, or quality? We can have two of those, but we can't have all three. And besides blaming the government and the system, we need to take a look at ourselves in the mirror and start taking better care of our seniors. Start spending time with them and treat them like the gold they are. Because remember, one day you're going to be a senior and you're going to be in the exact same boat. Thank you everyone for watching and listening. I hope I broke down the Ontario long-term crisis sufficiently, went over two main problems, and stated some possible solutions on how to fix them. I would love to hear your thoughts on the Ontario long-term care crisis, what you think the problems are, and what are your solutions on how to fix the system and make it better. Please leave that down in the comment section. I really look forward to reading them and replying.